Hi, today I will try to give you some clarity about the suction machine which is useful for the home, bedside patients, ICU procedures, endoscope machine and for the operation room. Basically, we get two variants of machines in the suction apparatus. One is oil engine and the another one is the non-oil engine that is piston based. Till now, oil engines are commonly used in the hospital setup for which a regular oil change is required. I have shown the oil changing method in some other videos whose link is given in the description box. Today, I am showing this portable non-oil engine suction apparatus which is useful for bedside procedures, home usages and for the endoscopes. It has pumping rate of 15 liters per minute with minimal noise and MRP is 7,990 rupees only, but you can get it around at 5,500 rupees at Amazon whose link is given in the description box. Oil engine suction machine apparatus may cost you around 7,000 to 12,000 Indian rupees. Some suction apparatus which are used in the operation rooms and which are operable by the foot pedal may cost you around 25 to 30,000 Indian rupees. This suction apparatus is best for home usage in which we get some spares which is easily assembled and the filter which is given need to be fit in front side of the apparatus. So these are the tubes which need to be connected. So this larger tube is from machine to the patient and small tube is fitted to the from the filter, sorry, the collection tube to the machine, and in between and another small tube we get, so we can fit it with the filter. This is the regulator to increase and decrease the suctioning pressure, that is a negative pressure what we can get it, and we get enough negative pressure suctioning pressure to perform the normal functions in the hospital as well as for the home usage also. So to suck the phlegm, to clean the throat and all those things, this is more than sufficient, and it has switch on and off button and a collecting tube. So this is a jar, so which has means whatever the suctioning is done, it gets stored here. So we get a initially we get some nozzles here, so one visor and nozzle which need to be fit to the jar first. This larger tube, that is longer tube, is for the patient end, and another small tube comes which need to fit with another opening and need to connect it with the machine. In between, we can use the filter also. This is about the suctioning machine. If you like this video, then kindly subscribe and press the bell icon. Thank you.